The Ministry of Health is urging you, the public, to be proactive when it comes to protecting yourself against dengue fever. This morning, I welcome the Minister of Health, the Honorable Terrence Deyalsingh, alongside Dr. Pedram Lalla, a registrar at the Insect Vector and Control Division. Good morning, gentlemen.
Morning,
welcome to the
morning,
show.
sir.
Morning. How are we doing this morning?
Not too bad, not too bad.
All right, nice to hear that. So we see, I heard you say in the news a few weeks ago that dengue is back on the rise.
Yes.
And we need to be aware, we need to be careful. First of all, I want to start by asking for a breakdown of what dengue fever really is and how it affects the human body.
So I think the goodly doctor is the better person
No
to
problem.
address that.
Dr. Lalla.
So to make it as simple as possible, dengue is a virus, of which there are 5 types, 4 which affect humans. The type doesn't matter as much to us because the treatment is the same. Now, the signs and symptoms are generally headache, it can be moderate to high fever, nausea, you may get a skin rash, pain behind the eyes. Those are the typical symptoms we get. And you tend to get this virus from the Aedes mosquito, of which there are 2 types, Aedes aegypti, which is a popular one, and Aedes albopictus. As of recently, and across the world, not just in Trinidad, there has been a massive rise in dengue cases, very synonymous with the rainy season. So the more rain that we get, the higher likelihood of water being pooled in certain areas, and that then becomes a breeding ground for those mosquitoes, which can then spread the virus.
Right. I just wanted to get a clarification on what causes, I mean, you mentioned some of these symptoms, but how come these symptoms lead to death?
So it's also a misnomer to think that dengue always leads to death, right? 75% of the people that get dengue will actually have no symptoms. 23 to 24% will just have very mild symptoms that I described before, and only 1 to 2% develop to severe dengue. Of those 1 to 2%, just a small fraction of those can possibly lead to death. Those persons tend to be, or the persons more at risk, tend to be very young kids, pregnant mothers, or elderly who are immunocompromised, or they have comorbidities like diabetes, hypertension, that type of thing.
All right, fantastic. So, Minister, what steps should we be taking to protect ourselves from getting dengue?
Yeah, thanks. So that's a good question for me. The population in Trinidad and Tobago has, unfortunately, over the years, become conditioned to think that having the country covered in a fog of spray, malathion, is the best way to control the mosquitoes. That is actually the worst thing to do. And we keep telling the country this year after year, that overspraying results in 2 negative effects. 1, the mosquitoes develop resistance, and therefore you create a bigger long-term problem that you can't control in the future. And 2, frequent exposure to the chemicals can negatively affect human health, animal health, fish, dragonflies, and your whole ecosystem.
And plants as well.
Plants, well, not plants so much, but dragonflies, which are part of your ecosystem. The ecosystem needs to be in balance. And when you overspray, you negatively affect the ecosystem. Now, there is a role for spraying. I'm not saying no. And Dr. Lalla could possibly go into when we spray, how we spray, and why we spray.
Okay.
The best thing the population can do is to heed the advice we put out year after year. Clean your surroundings. Especially, look, you have this saucer here this morning with water. This saucer, if it's in a yard, can probably incubate about 10,000 eggs. The females can lay that in this one saucer, 10,000 eggs. Multiply that by your clogged gutterings, multiply that by the bucket that you leave in the yard, the barrel, your drain.
The empty case of bottles.
Yeah, the empty case of bottles. Multiply that, and 1 yard could probably have
Millions.
millions of mosquitoes breeding. So the public has to realize that their role, their personal responsibility is to help us by cleaning their surroundings, their immediate surroundings. Even the vase inside your house with flowers, the Aedes aegypti goes in there and lays its eggs. And when we spray externally, are we reaching that? The answer is no. Right? So there is a role for spraying, not saying no, but the public, we have to keep our surroundings clean.
All right, so what I'm hearing you saying, Minister, is that prevention is better than cure, and
Correct.
the spray seems
Always.
more like a cure than prevention.
Yeah.
So tell me about when we spray and why we spray, Dr. Lalla.
So, first of all, just to sort of expound on what the minister said, when we talk about when we need to spray and why we need to spray and so forth, and we speak about source reduction, when you look at the life cycle of a mosquito, 3 of the 4 stages are underwater, or at the surface of the water, underwater. So at any given point in time, your sort of potential mosquito population, 3/4 of that is in a vase or in a bottle or something like that, unkept around the home. So that's why source reduction is so important and why that really sort of kills the majority of the mosquitoes. Going forward to spraying now, the only time we really spray is if there is presence of disease. Now, yes, there may be, say if there's 1,000 Aedes aegypti mosquitoes around the home, only one of those may actually be a carrier for dengue.
Right.
There's a chance none of them will be a carrier for dengue. How we know is when someone develops a disease. So if someone presents with dengue fever, or we get a cluster of cases with dengue fever within an area, that's when we spray. Because at that point we know that there is an Aedes aegypti somewhere, or an Aedes albopictus somewhere in that vicinity with the disease, or a carrier of the disease, and therefore we spray to try to kill those adults. That's the only time really that we spray and we need to spray. Because otherwise you're killing these Aedes, but they're not carriers of the disease. What we really need to be focusing is that 3/4 of the potential population that's in water, that's being bred in water.
Do we see the eggs in the water? Can we see
You can't see the eggs. You can see the eggs, all of the stages you can see laid on the surface of the water.
And would doing something like, I don't know, adding bleach to the water, would that help? If for example, you have a barrel that you're storing water in case you don't have a consistent water supply, which I know WASA is working on, but if you do, if you, for example, you want to have a spare barrel in case of things,
Yes.
if I were to add bleach to that or add any sort of chemical to it, would that help the situation?
Bleach is safe in very small amounts,
Right.
but the ideal thing really in a case that would be to cover it to make sure that mosquitoes can't get onto the surface of the water.
Cover it with mesh.
Yeah.
With mesh?
Yeah.
Okay.
And just a point, when we spray, and this is always lost on the public, all you are killing is the adult mosquito.
Correct.
Not
You
the
are
eggs.
not
Not
killing
the
the
eggs.
eggs and the larvae and the pupae.
Yeah.
So you kill the adult, but a whole generation
Coming.
is coming up, and then what do? Spray again.
Yeah.
And then you kill the adults again. You spray again. And that's how the mosquitoes build up resistance and creates a bigger, massive, long-term problem. We now have a whole generation of mosquitoes that will laugh at you when you spray.
So, and are we there already? Because I know we spray, and since I'm a boy, I know this Malatian spray. I know that smell very familiar.
Yeah.
Always smelling it almost every rainy season. So are we already at that point?
We are currently doing insecticide resistance testing together with CARFA to see where we're at in terms of resistance. Now, that's not the only chemical we use. There are other ones, but that's the way that we test to make sure. Now, we routinely switch every 6 to 8 years.
Switch to the chemical that we use?
Yeah.
Okay.
All WHO approved. We don't
Right.
go anything that's not approved, obviously. And basically what we do is we see if what we're using is working. So that's what we do. That's why we do IRT or resistance testing. So that's where we're at the moment with what we currently have. We did switch over the chemicals last year.
Okay.
But again, we try to keep those only where there are clusters of disease. We don't want to be spraying indiscriminately because, again, we just end up in this loop. Because yes, you may kill 1/4 of the adult population, but 3/4 of the potential mosquitoes are still underwater, and they will just rear their head.
And tell me about treatment for dengue fever. What sort of treatment should be required if persons were to present with symptoms?
Right. So it depends on the severity of the dengue. Now, again, most people, 98% of them, are going to have very mild symptoms. And what we ask is that you keep hydrated. That's your primary thing. If you have a fever or you get pain, use paracetamol or Panadol is a brand name that most people would know. We want to avoid using something called non-steroidal anti-inflammatory drugs. So that's your aspirin, that's your ibuprofen, Motrin, Cataflam, Olfen, those types of drugs. We ask people to stick to Panadol. That's actually pretty much it at home. It's all conservative. What you want to look out for the signs of severe dengue. So that's vomiting more than 3 times in 24 hours, severe abdominal pain, or what we call mucosal bleed or bleeding, usually through the gums or through the nose.
Okay.
If you get those, we ask that you seek help with your healthcare provider urgently.
All right, fantastic. Minister, when you mentioned the first dengue death that we had for this year, I got concerned and I wondered if it was a situation that we should all be concerned about as bad as we were concerned for something like COVID. Because when you came and you made the announcement, it was almost with the same sincerity and the same, I understand it's another life going, but the same passion that I saw you had when we first had the COVID reports coming to Trinidad and Tobago. Should we be as concerned as that?
Well, look, let's look at the numbers. COVID, over a period of about 2 years, unfortunately claimed over 4,000 lives. Dengue is not going to do that. However, one life is a tragedy for me, and one life is a tragedy for the family.
Of course.
So we must be concerned. For the year to date for this season, we have recorded, unfortunately, 2 deaths. And they have made their stories public. One is a 16-year-old. I can say that now because the family came out and made it public. And one is an elderly person. And it fits in with the model that Dr. Lalla was talking about, the young, the elderly. There's a similarity that Dr. Lalla was talking about, comorbidities.
Comorbidities, yeah.
The elderly with diabetes, hypertension, all these things have to be very careful. So we advise those persons to wear long sleeves, especially dusk and dawn, where the mosquito is more active. Sleep below a net.
Okay.
Use insect repellents. Dengue is not going to claim as many lives as COVID did. It's not that easily transmissible. It's not transmissible person to person as COVID. You have to be bitten by an infected mosquito. So the number of deaths globally is going up. What you are seeing, like United States, as you move from states, southern states of the United States, which were typically temperate because of global warming, as the states get warmer and warmer going north, you are now seeing dengue
going up with it.
in those former temperate states. So I keep telling the population that weather patterns, El Nino, La Nina, global warming, abnormal rainfalls, all of these things are contributing to the rise in dengue, and the region in the world that is seeing the biggest increase is the region of the Americas, of which we are a part. What we are going through now is what Jamaica went through earlier in the year, what Barbados went through last year. This is our turn now to cope with dengue. So we ask people to work with us with source reduction. Clean your gutterings, empty out your vases inside. And don't just pour the water. You have to take something and scrub the inside because the eggs would stick on there.
To the sides.
And even if there is no water, those eggs can be viable for about what?
A year.
A year.
Yeah.
So when you reintroduce water into that vase,
the eggs continue growing.
the eggs continue. Those eggs remain viable in a dry vase inside your house for up to a year.
Wow.
They remain viable in a dry
Saucer.
plant pot saucer, which we love. Many people have in their porches an array of
Plants. Yeah.
with saucers collecting water, and your living room and your bedroom is just 20 feet away. That is the risk you are putting yourself at. And no amount of spraying is going to get to that.
So in terms of situations like that where people have plants in their yard or inside the house even, how often should they be changing that water?
It's not a matter of changing the water, it's a matter of getting rid of the receptacle at the bottom of the pot.
But if you don't want it, when you water the plant, you don't want your whole house to get wet out, so you have a receptacle there for that.
Make a choice, then your plant. I am serious.
No, but is there not
choice.
so is there not a situation where we can change the water frequently? Like for example, if the vase in your house where you have you might have some nice flowers, right?
Yeah.
Can we change that vase water often to be able to prevent
once
it?
per week. At least once per week, yeah.
Okay, and that can go for all the plant stuff around the
you
house.
have to scrub.
Of course,
Correct,
you scrub it
yeah.
every time.
You have to scrub the inside of the vase.
Yeah,
right?
every single time.
Every single time.
Okay.
Don't just pour the water
And change
and
it.
add more water. You have to scrub it. And how many of us, I know people with 50 plants in their house.
Them and scrubbing all 50 of them saucers.
Is anybody going to scrub out 50 saucers?
Chances are slim. Chances are slim, at least not weekly.
But let's be honest, the chances are none.
Yeah.
And what, no, I mean, we might be laughing, but the truth is, until you get rid of the receptacle containing this water, you are inviting dengue into your home. The best thing to do is to get rid of the saucer, turn it over, or move it out completely.
Okay. All right, well, we know what we have to do. We have a lot of work to do. Anything else you want to add before we wrap this morning,
let me
Minister?
just give the population the latest figures. I confer with Dr. Hines. You may remember Dr. Hines from COVID times. Our number of cases still remains at 229. That is laboratory confirmed cases from CARFA. And our deaths remain at 2 for the time being. Hopefully it remains there, but the population really has to come on board with us with source reduction. I'm really pleading with the population, examine your yards. Source reduction is the way to go.
But not just the yards, inside and outside as well.
Your drains, yeah.
All right, well, I want to say thank you very much, Dr. Lalla. Thank you very much, Minister Deyalsingh, for joining us this morning and for sharing this information. Hopefully, Trinidad and Tobago will heed the call and we will take care of our surroundings. We need that source reduction. Get rid of the receptacles around your house and inside your house. Make sure you clean those vases every week. Once a week, scrub them out, clean them out, change the water, yeah? Thank you so much for joining us again, gentlemen. Enjoy the rest of your day. We take a quick break, and we come back with more on the Now Morning Show. Stay tuned.